Good afternoon, everyone, and thank you for choosing Across the Fence. I'm Will Michael in this afternoon for Judy Simpson. The first official day of summer is still a couple of weeks away, but the weather is obviously heated up and we're spending some needed time outdoors, which means we need to protect our skin. It's critically important because skin cancer is the most common cancer in this country. So today we're going to learn about skin cancer, how you can protect yourself and those you care about. And as you've seen, my guest is Dr. Glenn Goldman. Dr. Goldman is the Medical Director of Dermatology at the University of Vermont Medical Center. He's been with us before, and I always learn something every time you're with us, so thank you very much for coming in.
Thank you for having me.
An overview. We're aware there's much more awareness of skin and skin cancer, but the basic question, why is it important, Dr. Goldman, that we protect our skin?
Well, skin cancer is the most common cancer. There are going to be about 3 million cases of skin cancer in the United States this year. Most of those are readily treated, but about 75,000 of those will be melanomas. And one thing people in Vermont may not realize is that we actually have a very high incidence of skin cancer. It is one of the highest in the country, and it's from a number of things. And we are a fair group of people here. And in addition, people do a lot of stuff in the sun, and whether that's skiing, farming, outdoor activities, that all exposes us. And if we can protect ourselves, we can reduce the number of skin cancers. It turns out that about 90% of skin cancers are caused by sun exposure lifelong. So whatever we can do to protect ourselves has the ability to be helpful.
And I said in the beginning, we're in the summer months, things are heating up. And while that is critically important, the point you're making about being here in Vermont in the winter, not only the UV rays that we're going to talk about, but we have reflection from skiing, from being outdoors. So I guess I'm correcting myself. We don't want to leave folks with the impression that we only need to be careful of UV and skin cancer in the summer.
That's correct. And, you know, obviously in the wintertime, most of us is covered, but our faces are exposed. I think the issue in the summer is that people are warm, they're wearing short sleeves and short clothing. And so there's a need for a little more in the way of protection.
Exposing parts of the body, a back is a great example that hasn't seen sun for many months.
Absolutely.
Yeah. Now you used one of the words that we're going to get into, the melanoma, because that is one of my notes in visiting with you. That's one of 3 different types of skin cancer. It seems to me it's the one we hear the most about, and maybe it's because it's the most deadly, or you'll tell us, but I have notes here that there are 3 different types of skin cancer.
That's correct. The majority of skin cancers that people have, and these are usually in fair-skinned individuals, are basal cell skin cancers. And basal cell skin cancers are a locally destructive growth. If you look on the photograph, there's one at the bottom. It says superficial basal cell carcinoma, but they normally present as a spot that won't heal or bleeds. And
this could be anywhere on the body.
Could be anywhere on the body. It's usually in a sun-exposed area. So normally it'll be a slow-growing, festering sore, and it just won't heal. A lot of people think they're a bug bite or an acne lesion, but if it doesn't go away over a period of a few months, that is usually a basal cell skin cancer. And those are treated readily, usually in an office with a small surgery.
Will it bother me? Will I notice it? Will it itch? Will it?
It may not, and
okay.
You know, that's a good question. Basal cell carcinomas tend to be asymptomatic. The second most common type of skin cancer is called a squamous carcinoma. They tend to be a scaly, or what we call keratotic spot, and if you look, there's a squamous carcinoma on the upper right. They tend to grow a little more quickly, they tend to be more sore, and people tend to think there's something wrong. And so they're a little bit more likely to go to the doctor and say, this is growing and it shouldn't be there, and I think there's something wrong with it. And squamous carcinomas are usually cured. They can spread or metastasize, and they do cause a significant number of fatalities, maybe up to 3,500 to 5,000 in the U.S. each year, usually in older patients.
It looked to me as if in the picture, I'd call it elevated. In other words, the basal cell looked, you said a bug bite it, but it looked like it might be a little more flush to the skin, and it looked like the squamous cell that you were showing us is elevated. Is that correct?
You know, basal cells can be elevated. Squamous cells are usually elevated. They're usually more of a growth per se, or, you know, and sometimes they present as a frank tumor. Patients tend to be more aware of them than they are of the basal cell carcinomas, just due to the fact that they're growing more quickly, they're tender, even painful.
Okay.
And then
there's a third one on your screen, which you're just about to take us to, and I just was going to say, this is what you call the third most common skin cancer, but this one is the most deadly.
That's correct. And melanoma is a tumor or skin cancer of pigmented cells, usually. And if you look, there are some diagrams. Normally, a melanoma will be black and brown, red and black, red and brown. It will be a multicolored, irregular, often flat area on the skin. And it will be like a mole that looks different from everything else or has changed. Melanomas may grow slowly or rapidly. They are almost never symptomatic. And so, and they generally don't bleed until they're very advanced. And melanomas do have the ability to spread or metastasize. I will say that most people with melanomas are cured just with a local surgery. But when they are more advanced,
when we let them, yeah. Now, again, this is important. I think you say they're asymptomatic, meaning I need to pay attention to my body. I need to be looking. I need to do a check. Because I'm not necessarily going to go, oh, that hurts.
Yeah, I mean, there's the old Sesame Street refrain of one of these things doesn't look like or does not belong with the others. And, you know, as we age, we all accumulate barnacles all over ourselves, and the vast majority of those are harmless. I mean, you cannot find an individual my age or older who doesn't have something on their skin. But what happens is you look and that's not the same. It's changed over time. It's irregular now, and that's the type of thing that we worry about. And it looks different from everything else.
We're going to get, you're actually going to, one of the diagrams you brought is going to sort of explain to us. So move us along, I apologize. These different types of skin cancers do mean, though, that each one develops differently?
They do all develop differently.
Generally a result of UV exposure, but as we see your slide on anatomy of skin, they're going to develop a little bit differently.
They will, and this is just a section of skin. The skin cancers, for the most part, all develop from the upper layer or epidermis. But basal cell and squamous carcinoma are from what are known as keratinocytes, whereas melanoma are from melanocytes or pigment cells.
What makes melanoma more deadly then, Dr. Goldman?
Well, you know, melanoma it just has a higher ability to spread throughout the body. Mm-hmm. And, you know, there are some amazing new medications available systemically when melanoma has spread. I mean, remarkable. And in some cases, patients can live for a very long time or even, frankly, be cured from a melanoma even after it's spread. Now, 5 to 10 years ago, I could not tell you that. That has changed.
Touch very briefly on the different types of light. We all think, is it all equal? We go out in the sun and it's an issue?
You know, in terms of light, you know, you have visible light, you have heat, which is also, you know, coming from the sun, and then you have ultraviolet light. Ultraviolet light is a little different in that it has a shorter wavelength and a little higher frequency. You can't see it. It's just off the side of the visual light scale. And there are different types of ultraviolet light that come through. The main one contributing to skin cancer is felt to be ultraviolet B. and that is the one that most of the sunscreens will protect you against. There's another form known as ultraviolet A with a little longer wavelength that the sunscreens now also protect against.
Sunscreen, number one best product, that's what we need to use. In other words, is there any other way around of protecting ourselves that's better than sunblock or sunscreen?
I would actually say there are better ways of protecting yourself. The first is to wear clothes. And,
excellent point.
That's
And that
number
includes
one.
hats.
Hats, and by the way, also sunglasses, because that can help you to protect against cataracts. But number two is also not going out in the direct sunlight. My own feeling is that the early morning and the afternoon are often more comfortable time of day to be out. The sun is not as strong before the hours of, say, 10 in the morning and after the hour of about 4. So if I am going to be on the lake or at the beach, I tend not to be there right in the middle of the day. And then the last peg is sunscreen. And I do think sunscreen is very helpful. I was out in the sun a great deal this weekend with my boys. I wore sunscreen. I'm slightly pink, but I did not get burned. Haven't been burned for years.
Picking up, and you're reminding me, you're with your boys. They're now teenagers, early 20s. My point being, or my question is, those sun exposures that we have as young kids at the swimming pool or out with mom and dad at 4, 5, 7, 8, 10 years old, we have a much better understanding now that those incidents, those young burns that's a real problem.
That's correct. And, burns throughout our lives are important, and that and just cumulative sun exposure, but particularly bad burns. And, the one thing I note is that kids don't tend to get as many burns as they used to. Parents, I think, are better about protecting their kids. I can remember peeling the snakeskin off my back every summer. And on my neck and on my ears, and
not anymore.
That just does not happen with the same frequency. The ice water baths, all of that, we rarely see that unless someone falls asleep in the sun.
Dr. Goldman, we have just a couple of minutes left, and I want to take us to the body check part. And you began to touch on some of this, but you brought in another slide that really is important about what we should be looking for.
Yeah, I think this is a picture of a little more advanced melanoma. Sometimes we hope that people get things a little earlier, but if you have a mole that is irregular in shape, can't be divided symmetrically, has multiple colors to it, or you have a spot that perpetually bleeds or is tender and growing, those are things that you should bring to someone's attention, whether that's your primary physician or whether it's a dermatologist or plastic surgeon or whomever you would see, nurse practitioner, PA, just somebody to look at it. And the other thing I would say, which is I do think very important in terms of who you see, there are many people who have training in skin cancer. If someone says, well, I'm not really sure what it is, but let's watch it, I don't like that route. They either say, I know what it is and it's benign, or let's take a sample of that. Because our rule is if we don't know what it is, it gets a biopsy. And the reason is that provides a wealth of information.
Just about a minute left, and let me just follow up on that, making sure I understood what you said. Somebody looks at me and says, we want to keep an eye on it. You want to check it. You either want to know what it is or you want a biopsy. You're saying taking a look at it or keeping an eye on it really isn't an option?
Keeping an eye on it is not the greatest option. Normally what we will tell a patient is, that's benign. I mean, I could be wrong, but 99% it's benign, and let's just, we'll see you next year.
Okay.
Or, I don't know what this is. And it's okay to say, I don't know what this is. A skin biopsy is not a hard procedure. Many primary physicians, nurse practitioners, PAs, dermatologists, surgeons will do a skin biopsy. It gives a wealth of information. And if it's benign, it puts you at ease. And if it's something that needs to be dealt with, then we deal with it.
I need to stop us there as we're just about out of time. Glenn Goldman, thank you very much for being with us. That is our program for today. We know you have choices, so thanks for choosing us. I'm Will Michael, inviting you to join us back here each weekday afternoon. Another visit across the fence.